Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, board-certified doctor of non-force chiropractic and practitioner of functional medicine. Thank you for tuning in to learn how to take better care of your health and perhaps even be entertained in the process. I'm going to talk about essential vitamins and minerals this week, a continuation of some things we talked about last week. Last week, I did a calm, dispassionate, unbiased dissertation on why no one should take gummy supplements, especially gummy multivitamins, because they're mostly candy and simply not useful for maintaining human health. But in the course of explaining a related topic, namely why the U.S. government's daily values, recommended daily values of vitamins and minerals, are nearly useless as health information, instead, think of them as the minimum amount necessary to prevent severe vitamin deficiency diseases. They have nothing to do with maintaining health. But in the course of looking up the exact numbers, I came across a really good website hosted by the FDA. Not all government websites are useless. Some of them still provide really useful information. And I'm going to post this one in the podcast, and it'll be listed in the transcription. I recommend it. Check it out. It's a chart called the Interactive Nutrition Facts Label from the U.S. Food and Drug Administration. What's great about it is, in addition to the uselessly insufficient amounts of each vitamin recommended, if your goal is to maintain health, in addition to this, it also, and more importantly, it tells what each vitamin does, the function of each of these vitamins, why they're important, what function in the body it helps support, and good food sources of that vitamin. So, for example, it explains that folate or folic acid helps prevent birth defects. Many people know that folate is one of the most important vitamins in any prenatal vitamin, and for that reason, and it also helps with protein metabolism and the formation of red blood cells. Next to this, it lists good food sources to get folic acid from, including asparagus, avocados, beans, and peas, and green leafy vegetables. Of course, it also recommends getting folate from enriched grain products and fortified orange juice, which I don't recommend. Another good example is it lists the fact that vitamin B12 is essential for conversion of food into energy. A lot of people get B12 shots or take B12 for energy. B12 doesn't give you energy. It is essential for the conversion of food into energy. It's also important for nervous system function and to produce red blood cells, for red blood cell formation. And this is why B12 is one of the most important vitamins for anyone to get adequate amounts of, and it's also one of the most common deficiencies. Most people do not get enough B12 in their diet. So this document lists good food sources of vitamin B12, dairy products, eggs, fortified cereals. I do not recommend fortified cereals. When you see the word fortified on a quote-unquote food label, quote-unquote food product, what you really want to think is, imagine that it says instead, we've stripped almost all the nutrients out of this ultra-processed food, so we're going to put a few of them back in their cheapest possible forms and call it fortified to confuse you into thinking that it's good for you. Fortified foods are basically denatured foods stripped of nutrients to make them, to give them long shelf life, and in certain situations to give you sufficient, just tiny doses of things to save your life if you live in an area where you don't have access to real food. So if you live in an impoverished area and have no access to fresh fruits and vegetables and quality animal protein, then fortified bread and rice will be better than eating nothing, but only just. So you get decent amounts, you get good amounts of B12, mainly from meat, poultry, and seafood. So animal protein, B12, there's lots of B12 in liver, which is why carnivores, if you ever watch the shows showing lions and tigers and bears ripping into animals that they've caught, they often eat the organs first because they instinctively know that they need the nutrients, especially in the liver, and B12 is one of the main ones. But many people choose not to eat any animal protein, vegans and vegetarians, and even the vast majority who do eat sufficient amounts of animal protein often don't absorb all of it. They don't absorb the protein, and especially it's difficult to absorb the B12, even if you're eating a sufficient amount of it for a whole host of reasons. This is a great example of why it's so important for many people to take a good multivitamin or other supplement source to make sure that you're getting adequate amounts of vitamin B12. The paltry 2.4 micrograms is the US RDA recommended for B12. That's just barely enough to prevent pernicious anemia. Pernicious anemia used to be a death sentence until it was discovered in the early 20th century that if you fed people liver, it would cure pernicious anemia. And then around the 50s or 60s, a few decades later, they identified that B12, vitamin B12, was the substance that it's in abundance in liver that cures and prevents pernicious anemia. It's essential for forming red blood cells. Well, so you can also just take a vitamin B12 supplement. A lot of people go out and get B12 shots, quote unquote, for energy. So, it's a good idea to understand that B12 doesn't give you energy. B12 is essential for converting food into energy. So if you lack energy and you suspect that you're deficient in B12, of course, the best way is to test. You don't even need to test B12 directly. I prefer to test a CBC, a complete blood count. If you're deficient in B12 and folate, what you'll see on a complete blood count is that your older red blood cells get larger to take up the slack for the fact that your body's not making enough new ones. They get bigger. That's a classic sign of insufficient B12 and folate. But you don't need to get a shot. You can just take a sublingual, underneath the tongue, tablet of B12, and especially if you get the active form, methylcobalamin, instead of cyanocobalamin. 99% of supplements, all cheap supplements, have read your labels. If you have a cheap one-a-day multivitamin or a B12 supplement that you bought from Costco, read the label. I guarantee you it will say cyanocobalamin. That's a little bit better than nothing, but it's much better to take methylcobalamin, the active form, and especially in a sublingual. It's a little pink tablet that you hold under your tongue. It dissolves and directly enters your bloodstream under your tongue, and it works just as well. In fact, for many people, it works better than getting a shot because you're not getting a huge dose all at once that your body stores and then slowly releases. There's nothing wrong with doing it that way, but it just makes more sense to me to get a little bit every day. Especially if you're deficient in it, let it dissolve under your tongue. Your body will store up any excess. As with all water-soluble vitamins, vitamin C and all the B vitamins, it is virtually impossible, very difficult to take too much of any B vitamin. And so many people are deficient because there's a host of reasons that make it difficult to absorb B12, especially from your digestive tract. There's a gene SNP that about 15% of the population have that make it difficult to absorb it. You need hydrochloric acid in your stomach to break it down, and then it's not actually absorbed until about 30 feet later at the very end of your small intestine. And there are a lot of things, including effects from your gut microbiome that can impair the ability to absorb it. There's a whole bunch of things that need to happen. When you're super healthy and young, you absorb B12 easily. As you get a little bit older, it becomes increasingly difficult, and that's why for many people it's a good idea to supplement vitamin B12. This FDA website, fact sheet on vitamins, recommended amounts and sources. The recommended amounts are way too small, but as another example, it explains how vitamin C is important because it is an antioxidant. Vitamin C is essential for collagen and connective tissue formation, for wound healing, and general immune system function. So nobody gets enough vitamin C from their diet to keep their immune system strong. That's why it's important. I recommend most people take at least 500 milligrams of vitamin C a day. Well, the recommended daily value is sometimes 60. I think on this page it says 35. It's ridiculously low amounts, just enough to prevent scurvy. But it's almost impossible to take too much vitamin C. If you take too much vitamin C, all it'll do is cause soft stools. So Linus Pauling, the discoverer of vitamin C, took 15 grams. That's 15,000 milligrams of vitamin C every day for years. Well, if you take that much, it might cause diarrhea. It might cause soft stools. But when you're if someone is really sick, if somebody has a severe cold or flu or infection, it's a good idea to take somewhere in the neighborhood of 12,000, 3,000 milligrams of vitamin C 3 or 4 times a day. You quickly get up to 12 to 15,000 milligrams in a day when you're sick because your body uses a lot more then. And the worst thing that'll happen if you take too much is you get a little soft stools and then you back it off by 1,000 and it'll go back to normal. But in the meantime, it'll boost your immune system and maximize your body's ability to fight off whatever bug your immune system is trying to get rid of. And vitamin C is an essential component of that natural healing response. Anybody, for example, who just finds themselves constantly sick or finds that if they get a cold or a flu, instead of it going away in a couple of days, it takes a couple of weeks or a couple of months, People in this situation should take at least 1,000 milligrams of vitamin C every day, and preferably 1,000 milligrams 3 times a day. So you're keeping that in your system. It's water soluble. Your body flushes it out in a few hours. So that is one vitamin that it's good to spread out over the day. Take 1,000 milligrams 3 times a day if you're a person that finds it difficult to fight off a cold or a flu, or even up to 2 or 3 times that amount when you're sick. 3,000 milligrams 3 times a day. So the website, the FDA website, lists good food sources. Everyone knows you can get vitamin C from oranges and strawberries, but it often surprises people that you can get lots of vitamin C from broccoli and Brussels sprouts and peppers and tomatoes. And many of these sources have more vitamin C than oranges and strawberries. Of course, the FDA website recommends that you get your vitamin C from fruit like cantaloupe and citrus fruits, obviously, kiwi. But a lot of these things, grapefruit juice, a lot of these things have so much sugar that they're better off avoiding a lot of fruits, and especially any kind of fruit juice. If you're pre-diabetic, if you're overweight, if you're fatigued, then a component of that is probably getting too much sugar in your diet, and all fruit juices should be a no-go. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. If you just tuned in, we're talking about a really good website that I recommend people check out from the Food and Drug Administration. There's something that's really useless about it, which is the ridiculously low amounts that are called the daily value for each vitamin and mineral. Those are also on this website. But in addition to those useless, overly low values of each vitamin and mineral that are recommended to keep your body healthy and strong, it does list good food sources for each vitamin and the functions, what each vitamin does in your body. And these are things that most people are interested in. So another great example of the egregiously low values listed is the FDA recommended daily value of vitamin D, 20 micrograms. 20 micrograms of vitamin D is 800 international units, 800 IU, which is the highest they recommend on any product. Many vitamin products still list the daily value of 400 units a day, or 600 if you're pregnant or elderly. And that's just barely enough to prevent your bones from collapsing. It is nowhere near enough to begin dramatically reducing your risk of osteoporosis, and absolutely nowhere enough to keep your immune system strong. Vitamin D has a function in virtually every organ and system in your body, but the most important of them is to keep your immune system strong. And many people think they don't need to eat anything to keep vitamin D. Everyone knows we get vitamin D from the sun, right? Oh, I garden. I spent 2 hours yesterday with my shorts on, and I must be getting plenty of vitamin D. Well, you have no idea if you're getting enough vitamin D unless you get your blood tested. And guess what? Well, I've tested thousands of people. Colleagues of mine test millions of people. Even your regular doctor will order the vitamin D test if you ask him now. Medical doctors are aware of the overwhelming research that shows the importance of vitamin D on preventing cancers, maintaining immune system function, reducing your risk and severity of colds and flus, heart disease, brain health. The research is out there. So they will, or any doctor will order that test for you if you request it. And that's great. But the problem is they'll also tell you that if your vitamin D level in your blood is 30, you're fine. Well, that's egregiously misinformed. The healthy range of vitamin D is 50 to 90. If you want your immune system to work normally at its peak, reduce your risk of colds and flus and the severity of a whole host of diseases. If you want your immune system to be strong, you need your serum level of vitamin D to be between 50 and 90. And if you are not taking a vitamin D supplement in the range of 5,000 units a day, then I can virtually guarantee you that your blood level will not be between 50 and 90. So hardly anyone gets enough vitamin D from the sun. In Southern California, if you're a white person and you expose your torso with your shirt off, your torso to the sun without any sunscreen on for 20 minutes, 3 times a week, then your blood level is likely to be in that healthy range. But hardly anyone does that. When we go out in the sun, we wear hats and clothes and sunscreen. Any part of your skin that is covered by clothes, obviously, but people don't realize if you have sunscreen on, you're also not making any vitamin D. And the more important thing is most people think if they're out in the sun in short pants and a short sleeve shirt that they're getting any significant amount of vitamin D. And they're usually not enough to keep your immune system strong, not enough to test your blood level in the range of 50 to 90. So yeah, if you ask any doctor, they will test that. They'll do that test for you, and then your insurance will pay for it. That's great, but don't ask them If it's good, ask them what the number is. Get them to give you a printed report. You want to know if that number is at least 50, not if it's at least 30. MDs will tell you the broad range on the lab report from LabCorp or Quest or any major lab says that the normal range for vitamin D is 30 to 100. And that's really interesting because a lot of doctors will say, if it's above 30, you're fine. That's not true. It should be above 50. But I've also had so many patients come in and they'll say, oh, my doctor told me I need to make sure I'm not taking any vitamin D right now because it's too high. It was 40 or it was 45. Because they think it should they just think it should be right at 30. And the normal bottom of the normal range used to be 20 for many years. So that's an increase. So a lot of misinformed doctors that don't do the research, don't keep up with the research on vitamin D, still think that 30 on your blood test is adequate, and it is not. You need it to be between 50 and 90, and anything below that is certainly not high. Anything below 100 is not high. That's the worst part. Regular doctors will tell people that their vitamin D is high when it's 50. Or 60 or 40 even, when it says right on the report that the normal range is 30 to 100. The main reason most doctors are worried about people taking too much vitamin D is because if you take too much long enough, then it can increase your risk of kidney stones. But does that ever actually happen? To increase your risk of getting kidney stones, you have to take vitamin D long enough and take crappy calcium. A lot of people do take crappy calcium by buying Costco multivitamins or calcium carbonate supplements. If you take that and 5,000 units of vitamin D, actually, you have to take about 10,000 units of vitamin D every day for a year to even start to increase your calcium levels. That's the most important part. The only way you're ever going to take too much vitamin D is if it starts to increase your serum calcium levels and you're taking crappy calcium carbonate supplements. Then vitamin D keeps calcium in circulation. So if you keep crappy calcium in circulation for too long, again, it has to be a long time. You have to really overdo it for a year or two before it will even begin to increase. I've had patients that took 10,000 units of vitamin D a day for a year, and it still didn't at all increase their calcium levels. Even 2 years sometimes. I've had patients that take 20,000 units of vitamin D for several months, no increase in their calcium levels. So it's possible to take too much vitamin D, but it almost never happens. And if you test your calcium levels at the same time and make sure that they're normal, you're totally fine. And even when it does, I've had a couple of patients that their serum vitamin D levels were over 100, and I'll just tell them to quit taking vitamin D for a month, and it goes back to normal. I had one patient recently who came in and their vitamin D level was 150. Well, the toxic level of vitamin D is 150. That's the government determined level of the point at which it can become toxic. And that's the first time in 30 years that I've seen anybody that had, and I've tested thousands of people, it's the first time I've ever seen anybody that had a vitamin D level of 150. And that was because this woman was taking 20,000 units of vitamin D every day for a couple of years. So nobody needs that much except for a few days when they're sick. The point is, it's very difficult to take too much. And most people, if they want to be healthy, should take 5,000 units a day and get your blood tested. Make sure your blood level is between 50 and 90. And you should always know, if somebody's convinced you otherwise, you should know that you will never have a blood level of 50 to 90 by just wearing short pants and walking outside in the sun. You're never going to get that amount from the sun. To get that level and maintain it, except for a few months in the summer, if you sunbathe naked 3 times a week for 20 minutes, you're going to be deficient unless you take about 5,000 units a day. Shifting gears here a bit, there's some more information that's come out recently in the medical press about a test that has been around for quite a while, but very few doctors use it. Cardiologists use it. It's called Lipoprotein A, or LP capital A, Lipoprotein A. This is a test that's kind of like testing your cholesterol levels, but it's much more important than the standard cholesterol tests because it's much more specific. It's much more strongly associated with some of the worst outcomes of plaque hardening of the arteries. So, for example, it's associated with blockage in the coronary arteries, as is a number of other things, but also blockage of the arteries in the kidneys and in the lower extremities, people that have peripheral artery disease and might have to have surgery because of that. Another peripheral artery, the carotid arteries in the neck, if you have blockages in that's a huge risk factor for a stroke. The little pieces of plaque that break off and cause a stroke often come from the carotid arteries in your neck. So this test, Lipoprotein A, is a way of measuring what is your risk of having a large amount of blockages, not just in the heart, but blockages of the arteries, plaque formation in the arteries, arteriosclerosis, anywhere in your body, but especially the heart, but also the legs, the kidneys, and among other places, the carotid arteries in your neck, which increase your risk of a stroke. So this is a study that was done on 460,000 participants in the United Kingdom Biobank that had their LPA, lipoprotein A concentrations measured, and then they were followed for about 14 years. And the concentrations varied significantly from the people that did have arteriosclerosis and those who did not. And it was strongly associated with stenosis of the carotid arteries, narrowing of the carotid arteries. If people had carotid stenosis and an elevated LPA, it increased their risk of stroke by 40%. If they had peripheral artery disease, the most common place for that is in the legs, that increased their 60% of having a major adverse limb event, meaning they had bad enough blockage of an artery in their legs or the hips where the aorta branches off to each leg that they would have to have surgery to fix that. So this test has been around for a while. A lot of progressive cardiologists, there are functional medicine practitioners who are also cardiologists, and they order separate panels of a number of additional tests, some of which I've talked about on this show before, like BNP, B-type natriuretic peptide, homocysteine, other lipoproteins. There are a whole host of other blood tests there's a plaque test that can be measured, simple blood tests, that can more accurately assess your risk for a heart attack or a stroke versus just testing your cholesterol levels. The question is, should we test it? Everyone gets their cholesterol checked. Anytime you go to get blood work done by any doctor, they're going to check your cholesterol. I do the same. It's an important test. It's not as important as people make it out to be, but it is important to check your cholesterol levels. It's just equally important to not go crazy and immediately think you need to take a statin drug if it's elevated, because there's lots of other ways to lower your cholesterol without taking statin drugs like Lipitor, atorvastatin, simvastatin, etc. And cholesterol doesn't cause heart disease. Inflammation causes heart disease. So the inflammation that actually drives the formation of hardening of the arteries, this formation of plaque in your blood vessels, pieces of which can chip off and cause a stroke or become thick enough to close off an artery to your heart and cause a heart attack. There are other ways to measure for this. The only way to directly measure it is with invasive scans that have a lot of radiation, like a CT scan of your heart. A CT arteriogram is the most accurate way to measure how much plaque you have in your arteries, but that involves a lot of radiation and the injection of a dye, and it's just not necessary most of the time. You're not going to screen everybody with that kind of a test like we screen most people anytime they go to a doctor with a serum cholesterol test. There's some things that are in between. There's a lot of people have heard about the calcium score. This is a very low dose radiation CT, very thin slice through the heart, just a couple of images, CT scan through the heart to measure your calcium score, which shows calcified plaque in your coronary arteries. And the only downside of that is calcified plaque. It means it's been there for a long time and there's not really anything you can do about it. You can't get rid of the calcified plaque. It's the softer plaque in formation that hasn't become fully calcified yet that is the most dangerous, that is the most likely to cause a heart attack or a stroke, that is also reversible. And because that's soft and not fully calcified, it doesn't show up on a CT scan or an X-ray. The main reason the test is useful is if you have a lot of calcified plaque that shows up on those tests, then you're very likely to have larger than normal amounts of the softer plaque as well. But it doesn't measure that directly, and that's why it's nice to have these other blood tests that show your risk, heart attack or stroke, by measuring things that we can actually reverse and eliminate with nutrients to break down the scar tissue that begins the process of hardening in the arteries. Looks like we're about out of time. Thank you, as always, for tuning in. Remember, the condition of your body is always more important than any condition you've been diagnosed with. Try and do something today to become a little healthier than you were yesterday. Have a fantastic weekend.
You've been listening to Safe, Effective Natural Solutions with Dr. Todd Binkley. If you have a health question you want discussed on the show, email your health questions to Dr. Binkley at binkleyhealingcenter.com. Take advantage of this opportunity to ask questions for yourself and for your loved ones, because our health matters. Join him next Friday at 2 p.m. for safe, effective natural solutions here on 98.3 FM, The Word.